My name is Austin Prudente. I'm 11 years old and I'm in 6th grade.
My name's Katie Prudente, and I work on Long Island as a high school assistant principal.
I like to play golf with my mom, get away from my dad and my sister.
In my career as an educator, I have seen a huge increase in mental health issues that are occurring with students. But seeing this process as a parent has been really eye-opening for me. Austin did start to exhibit some anxiety even as early as 18 months old. But as he got a little bit older, these things kind of evolved, and this happy boy that was really just so kind all the time started to become a little bit angry.
It felt like I wasn't in control.
Seeing him unhappy was just kind of bleeding into the whole heart of our family. Knowing that there was the behavioral health center available and that our school district did cooperate with the program, we decided the best thing to do would really bring him just to be evaluated and see what we could do to help him feel better.
When I first met Austin, we became comfortable quite quickly. He had really been struggling with this long-standing anxiety. It can be very hard to speak outwardly about what you're going through. I think for Austin, providing that space that is safe and welcoming is what seemed to really allow him to connect to the treatments that would really help that.
I felt nervous and I was scared to go. But then Dr. Falkowitz, he's funny and he's nice to me. He always helps me and I trust him. And I feel like I have more control because I learned how to manage my stress better, to breathe calmly.
The school mental health partnerships really started with our work in Cohen's Children's Medical Center with our behavioral health emergency department, in recognizing that the emergency room is not the best place to give access to kids and families, and that there maybe is a better way. We're working with 55 school districts across Long Island. We have seen over 14,000 visits and have done over 2,500 consultations.
Mental health is a growing concern across the country, and our program is really about breaking down the barriers to mental health care, really with the intent of allowing for access to quality and immediate mental health support. The program is designed to be a short-term intervention to make sure that people ultimately find themselves successfully connected to ongoing care. That's really our goal.
It's been incredibly successful. He is doing better at school. His friendships are stronger. He's getting along better with his sister. And just overall, he's happier, and that was our end goal. I think it's really important that we speak openly about mental health. Just like you can have a sprained ankle, you can have some depression, some signs of anxiety. It doesn't have to be a crisis to get help.
Having Northwell and having communities and donors help really enables us to build programs that can then invest in the future of these kids.
Be it anxiety, depression, other mood concerns. Our approach is to try to connect with the youth, connect with the family, and have them walk out the door knowing that they're headed in a direction that's going to help.
I'm really grateful for my mom because she is the one that got me into this program, and I trust her to take care of me, and she's really nice and sweet.